Go for it.
Hi everyone, I'm here to talk about breast cancer today, particularly breast cancer awareness. I know there's a lot of information out there about early detection is the best chance for survival rate, but today I'm going to talk about the genetic testing of breast cancer. It is the actual testing of the genes, BRCA1 and BRCA2 genes, that we all carry. Both men and women carry the genes. Specifically, the BRCA1 and BRCA2 genes are information to doctors of whether we carry the hereditary gene for breast cancer and ovarian cancer. The BRCA1 and BRCA2 genes are genes that can be mutated, and once tested, if the doctors find that your genes are mutated in such a way, they will then know if you are a carrier of the hereditary gene for breast cancer, which means you will develop it at some point in your life. Depending on how mutated the BRCA1 and BRCA2 genes are, will depend on your early onset of breast cancer or later in the years for breast cancer. Your family history has a lot to do with whether you're a candidate for the genetic testing of the BRCA1 and BRCA2 gene test. You can have these tests, but they're simple tests. All it is draw a little blood, just like a regular blood work. They are done at laboratories or hospitals and then sent to labs that specialize in this genetic testing. Before having the test done, you really need to have counseling before and after the genetic testing is done. There could be a lot of psychological impacts of the test due to the fact that you can pass this hereditary gene onto your children. But early detection is the best survival rate for when men and women who carry these genes. Men are not excluded from having the breast cancer gene. They can also carry the gene. I know they can't get ovarian cancer, but they can, if they are tested positive for the BRCA1 gene, they can carry the gene that they will get early onset of testicular cancer, prostate cancer, pancreatic cancer. So it's important for men as well as women to have the testing done. But the thing you have to think about before getting the test done, the con to the whole testing, is that if you are tested positive for the gene, the BRCA1 or the BRCA2, certain insurance companies may not even pay for the genetic testing. They also may decline you as a candidate for their insurance. You can't test positive for a gene, and some insurance companies will not accept you as a carrier of their insurance because it is a pre-existing condition at that point. So that's something you really need to think about. If you do test positive for the gene, the things that you will have to go through for the rest of your life, you will have to think about. Every 6 months you will need a mammogram. It's usually required by the doctors. I know some people that have been tested positive for the BRCA1 gene. They have had hysterectomies under the age of 40 to prevent the ovarian cancer to occur. Other people have had their breast tissue removed because they tested positive for the gene. So there's a lot of pros and cons to being the testing, but like I said, the best survival rate is early detection. If you have family members, first relatives, mother, sister, aunt, you really should consider having the testing done. In the end, I believe it will help your survival rate. I hope that, this information, you can talk to your doctor. I think that it's a good thing to do. Okay, thank you.